So, welcome everyone. My name is Anjay Rastogi, and welcome to our chat. And this is part two of kidney transplantation. And we want to just thank everybody, especially our panelists and experts who are joining us. We do want to keep this program very interactive. So, if you have any questions, please do put them in the Q&A. If you have some fun fact, put them in the chat box. The only thing that we ask you not to do, and this is feedback that we got from attendees, is not to put your anecdotal experiences with some treatment, because that's one thing that we want to stay away from. This program is based on science and facts and data, and we really want to stick by that. So please refrain from just putting in your own experiences that you might think have some clinical relevance. If you do have them, please email it to us. We will look at them, and if we find that they are scientifically sound, we will discuss that at the next event. So with that, let's get into, we have the green ribbon, and this is 1st of May. And as a lot of you might know, that May is mental health month. And what connection does it have with kidney transplantation, or for that matter, end-stage kidney disease? And it has a lot of connection. And our resident psychologist, Dr. Jim Cunningham, we have a very big focus on wellness and mental health, and that is really a big part of what we call the comprehensive care that we give to our patients. We also know that a lot of patients, especially with advanced kidney disease and definitely with ESKD, suffer from depression, and this is a reactive depression to what situation they're in. And at UCLA, we're actually participating in a program called Kidney Care First, KCF. And a part of that KCF is screening for depression and anxiety. And we'll be going over that in a bit more detail. And then finally, we'll have some Q&A on kidney transplantation. But I do want to stress again the importance of mental health and wellness in the overall outcomes for our patients, especially with advanced and end-stage kidney disease. This is a common disclaimer that you have seen, that what we're presenting today is purely for your advice. Do not make any changes in your care without speaking to your healthcare provider. And this is our undergraduate club, and I'll tell you why this slide is actually quite significant today. This is our undergraduate club at UCLA that works with all healthcare providers and patient advocates to increase kidney health awareness. And this is our circle of core, our patient advocacy and support group. So with the Bruin Beans Health Club and Circle of Core, I wanted to introduce a very special new member for our patient advocacy. This is our contact information. You can call us. This is our direct office line. You can email us. Please do visit us on our website and follow us on Facebook. There's a lot of very, very vital information that we post on Facebook and Instagram. So please do contact us with your comments, with your questions, and also what you want to hear in the future. So with that, our today's special guest and introduction is Disha Yadav. She's our Green Ribbon Spotlight. This is a bit of her journey. She's a second-year psychobiology major at UCLA and is an active member of the Bruin Beans Health Club that I just mentioned, and now will be actively participating in our core kidney program as a patient advocate. She was diagnosed with lupus when she was very young, 11 years to be more specific, and then she advanced to end-stage kidney disease, or end-stage renal disease, like we like to call it. Now, she's going to share her story, but one of the things that I want to point out over here is that there was a lot of misdiagnosis, uncertainty, and they couldn't really put what was going on with her. And her kidney disease advanced. She finally ended up on dialysis and was give and take for 5 years on dialysis. A good portion of that, she was on peritoneal dialysis. Keep in mind, this is a child. She's barely in her early to mid-teens, but she's remained resilient. She eventually received a kidney transplant from a deceased donor in 2021, giving her a chance for a fresh start and marking a turning point in her life. And Disha, as a patient advocate, emphasizes the importance of acceptance, self-advocacy for individuals navigating similar health journeys. By the way, keep in mind she's only 19 years old. Her story inspires others, including me, to find strength and embrace their experiences, recognizing the value of perseverance in the face of adversity. So, with that, I want to introduce Disha, and Disha will share a bit more about her journey, where she is now, and where she's headed. So, Disha.
Thank you, Dr. Rastogi. Hi, everyone. I am Disha, and I am a second-year student at UCLA, majoring in psychobiology, as Dr. Rastogi mentioned. I am a member of Bruin Beans Health Club and UCLA Core Kidney as a patient advocate. I have spent a decent amount of time in my first year and as second year comes to an end, doing a lot of advocacy programs and kind of advocating at different events for chronic kidney disease and raising awareness related to the illness, having gone through it myself. I just wanted to go ahead and kind of acknowledge the fact and thank Core Kidney for giving me the chance to share my story. It is something that I've never gotten to do in terms of me actually verbally talking about it. So I'm actually very excited to get the chance to speak on the matter in general. The reason I really wanted to do this for Core Kidney and for all the patients that are listening is to kind of provide them with the support and provide them with the kind of ideology that you're not alone in what you're going through, and that even though you have your doctors, you have your family, and you have your friends, whoever, there are other patients out there that are going through a very similar stance to what you are going through and very similar symptoms, very similar daily attitudes, etc., how you feel on a mental basis, how you feel on a physical basis. So you have someone to sort of relate to and someone that's actually gone through all of this, endured all of the pain, endured all of the treatments, and still come out very strong and still come out in a stance that they want to help support other patients that are currently going through everything. So I wanted to go ahead and start a bit with my personal journey pre-diagnosis that kind of just mentions how I was really unprepared for the diagnosis that I did receive. I was a relatively healthy child overall. I didn't really have a common cold even growing up, very, very healthy in terms of those stances. I was active in sports. I was active in terms of exercise. I did many different variety of sports, specifically soccer, which was my main focus. But then when it came around 2016, I started to show a decent amount of symptoms that were not something that my doctors could pinpoint. My primary care providers were unable to kind of determine what was happening with me. Some of these symptoms included arthritis, which later determined was rheumatoid arthritis that accompanied my diagnosis. My hands were not straightening. My legs were constantly weak. They were also not straightening. I was constantly nauseous and vomiting leading up to my illness. I had rapid weight gain, diarrhea, fatigue, and weakness. I had a vaginal bulge that was actually misidentified by my doctors. They said it would go away. It didn't. It was actually the buildup of fluid in my body. And then one of the last biggest identifiers that kind of paved the way for my diagnosis was the butterfly rash that kind of accompanies lupus. So after all of these symptoms and kind of the misdiagnosis of what I had endured, um, I ended up being diagnosed with lupus nephritis and end-stage renal disease. I was a child that didn't really express what she was going through. I would go to my PE classes and kind of try to do all the exercises, but with the fatigue and weakness that I was enduring, I ended up not being able to properly do anything. And it was a difficult time having to watch all of my classmates be able to do the exercises properly and then struggle with them. I wasn't able to tell my family about it because, again, I wasn't a child that really expressed everything that was going on with her. I was very sheltered in terms of those specific emotions. Eventually, it got to a point where I did have to bring it up, and my mom actually noticed because a child that, you know, eats everything, whatever you put in front of her, all of her vegetables, everything, just randomly stops eating and stops wanting to eat, just everything makes her nauseous, you're gonna think something's wrong. So we ended up going to the doctor, and after a lot of misdiagnosis, I finally did get diagnosed with with my illness. I did spend 50 days in the hospital. It was a very difficult time post the diagnosis. I spent Thanksgiving, my 12th birthday, Christmas, New Year's, all in the hospital. It was a point in my life where kind of having hope for the future was very difficult. It's 50 days is a really long time. So having to spend that entire time in the hospital makes you kind of wonder why it was happening. Why did I, of all people, have to go through this, especially at the age that I was at? My friends were all out, at amusement parks, movies, picnics. They were running around, and I was stuck in the hospital connected to a hemodialysis machine and struggling to get up, struggling to do a lot of things. I did have a seizure once in the hospital, a lot of different issues that I was going through. And 50 days sitting on that hospital bed was by far one of the lowest points in my life in terms of how I was feeling mentally. I always thought I was on dozens of medications on the daily. I was connected to this strange machine that I genuinely didn't understand being at the age I was. I was having all of these surgeries, listening to doctors talk in fancy terms, and worst of all was kind of watching the terror in like my parents' eyes as they kind of had to see what their daughter was enduring. So it kind of baffled me for a while, like, was it something I did? How did I go from being that kid that all the parents would somewhat admire for not complaining about her fruits and vegetables to the sickly kid on the hospital bed? Or how did I go from being like a star soccer player to the girl who now has anemia, arthritis, and like a catheter in her chest? So it was a point in my life where hope was very difficult, and I struggled with it for a relatively decent amount of time. And kind of having to endure all of that at the age that I did was just something that was so hard on my mental health and something that I very much struggled with. So post leaving the 50 days in the hospital, this was 2017 at this point. I was on hemodialysis for about 6 months in 2017. I then took a 2 to 3 month break before being put on PD. So I was on PD until my transplant in 2021. So the hardest point of my life and my diagnosis was 2017 to 2018, kind of coming back into the real world out of the hospital and kind of having to see like, young kids my age going out, having fun, going to like games, playing with their friends, whatever, and kind of struggling to do that with the treatment that I was enduring. I was unmotivated, struggling with my renal diet and fluid intake, agitated. Every possible emotion that you could feel was something that I was feeling in that moment. I would often cry myself to sleep and like scream. It was difficult. It was a difficult time for sure. It would upset me sometimes, getting to see my younger sister get to eat whatever she wanted, and I had to portion everything I ate. I honestly give a lot of thanks to my mom at this point in my life where she kind of supported me in this endeavor and kind of ate the portions that I would eat to kind of show me that I wasn't alone. And that's something that I will forever be grateful for her for, which honestly was just so amazing to me. I do think I took it like advantage of my parents at some points, or like it was a difficult time for them as well. But, I would just talk to them a lot and tell them that they wouldn't understand what I was going through. They didn't know what I was going through. And obviously, they didn't directly face the illness, but they were watching it and they were doing their best in their own mental state, watching their daughter go through it to kind of support me. And it was very difficult for them as well. I do realize that now it took me a while, but I do want to just make sure I say thank you to my parents and my sister, especially as well, for supporting me through everything that I did endure during that time. So 2017 to 2018, like I said, was a very difficult time for me, trying to come to terms with my illness and try to be comfortable with what I was enduring. It wasn't easy. It was very hard having to force myself to go to school, force myself to interact with kids my age, or when I know that they couldn't relate to the struggle, and that was such a huge part of me. Sometimes I wanted to share it with friends and people that I interacted with, but it it was hard. I didn't want to be pitied. I didn't want people to sympathize or try to be like, "Oh, I understand. I'm so sorry you're going through that." I didn't want to hear that because, again, they didn't understand. They weren't going through it. And it was something that I didn't want. I didn't want pity, which is why I'm very thankful for my doctors for introducing me to one of the programs that I was a part of, like the Painted Turtle, where I was able to kind of interact with other kids my age that had kidney disease. So I had somewhat of a support system at one point in my life. I do still talk to a decent amount of those people. We were able to kind of share our struggles going through the illnesses, the different daily things that we were going to, being on peritoneal dialysis, the inability to sometimes wake up in the morning, etc. And it was just something that I was really grateful for overall. Now, kind of moving on to 2019 to 2020, this was a point in my life where I did start to kind of accept the reality of what I was going through. I did realize that this illness was such a huge part of who I was, and that I did need to learn to live with it. I wasn't going to be off PD anytime soon. In my eyes, I accepted it that PD was such a huge part of me, and that I did need to kind of accept everything that I was going through. Because if I didn't, I would just emotionally be detached from everything. I would probably struggle with family, struggle with friends, etc. It wasn't easy, obviously. I did have my moments. I will still say that I did get upset quite a lot. I did struggle even up until my transplant. It's not an easy journey, but it's something that you do need to, at one point, accept, because if without the acceptance, it's just more difficult on your mental health as well as your actual physical body. So I was a little bit happier during this time, kind of realizing that this was a part of me and that I did need to just kind of endure what I was going through. If I didn't accept it, I would just struggle mentally. So I started enjoying life a bit more. I started actually being happier in terms of what I was going through. I did have my daily struggles on my treatment plan. I was still nauseous all the time. My parents had issues trying to get me to eat on a daily basis. They worked really hard on that. Thank you to them for that. But going through everything was really hard, especially for the time that it was. It was peak high school. I was in like ninth to 10th grade, kind of coming to terms with everything. I found friends that were supportive of what I was going through. They didn't pity me. They realized that this was a part of me and that they just needed to accept it, that this was something that wasn't baggage that came with me. It was my personality. It was who I was. And they truly supported me through everything. Anytime I did have an issue, they didn't try to pity or empathize. They simply understood and said, I understand, and let me know how I can support you if I can in any way, which was great to hear from people. But it was still a difficult time in high school, having to get to school in the first place, having to endure everything that I did endure while still having to go to classes, having to deal with the monthly appointments, the constant blood work, procedures when procedures had to happen, constant calls from my doctors. At one point, it was actually, this is a very, for me at the time, it was a pretty embarrassing moment, but I did end up throwing up once at school, like in the middle of everything. And I did see so many people staring at me. I was struggling with that. But my friends came and kind of supported me at that moment and showed that though you have this illness, we're there for you and we will support you. And that support was just so important and integral in my recovery and my acceptance of my illness as well, that I was just so happy to have that in the moment. But besides the support I received, it's just so important to also realize that if one doesn't accept what they're going through by themselves, then the support doesn't matter. It doesn't matter who's there for you. If you're still struggling mentally with what you're going through, it doesn't matter who's there for you, how much time they give you to kind of help you go through your illness, you're not going to get better. The mental aspect of it is just so important in your journey, that realizing realizing that your struggles make you who you are and make you 10 times stronger as a person. It was always just tiring to hear from people how strong I was going through it, how strong I was, having to endure everything, until I told myself that I was strong, until I told myself that this isn't something that every person can go through this easily, but I'm working hard on it. I'm working hard to make myself better. I started listening to my parents a bit more in terms of trying to eat, trying to work on my diet a little better, trying to exercise more so that my body would physically be fit for when the time of transplant came around, and trying 10 times harder to just be happier with what I was. It's not an easy journey. It's going to take a while for anyone that's going through the illness, anyone that's dealing with the struggles, but eventually you get there. It's not something that you can happen in a day. It's not something that'll happen in a week. It's different per person, and everyone's journey is different. But the fact that acceptance is the final result is something that is dead set in your entire journey overall. So 2020 to 2021, I would argue, was both a very difficult time, but also a time when I was most happy with where I was at. 2020 was when COVID did hit. So dealing with my illness did slightly get easier. I felt a little less left out of things. COVID was obviously a very difficult time, but um, I felt a little less out of things in the beginning as everyone was kind of at home and everyone was kind of dealing with the same issue. So kind of being able to do my peritoneal dialysis at home while everyone else was there, I still got to talk to my friends over the phone, and it was a difficult time, but I still got through it and still was happy with where I was at because the acceptance I had given myself, the acceptance I had for the illness that I have was at its all-time high. It was a point where I was absolutely comfortable with it. I accepted the fact that I had peritoneal dialysis every night. I had to go through it, and I would go through it. Obviously, with the complications of peritoneal dialysis, dealing with everything, it was still a struggle, but it was some point where I was just happier with my illness and happier with who I was as a person. So this part was also a little confusing because in my mind, because in 2021, eventually I did get my transplant, and leading up to the transplant, I was a little scared. Obviously, transplant was the end goal, to eventually get a transplant so that I could live a better life, um, kind of overall be physically better and mentally better through the transplant. But it was still difficult to kind of deal with because I'd gotten so accustomed to being on dialysis, to being on peritoneal dialysis specifically, that I was scared of the change. I'd already realized that this peritoneal dialysis was such a huge part of my life, and I'd gotten to a point where I was exercising at a decent amount. I was taking care of my diet and my fluid intake. I was working hard mentally to make sure I was strong. I was um, happier. I accepted my illness. But now there was such a huge change in my treatment plan that I was scared to go through that change and kind of deal with everything that would happen post-transplant. Obviously, we had gone through the training, my family and I, but it was just very difficult to kind of realize that my life would change. The transplant would probably make my life 10 times better. It would make my life better, but it would mean that I would have to go through another huge change in my life that I wasn't ready to go through. That was my mindset kind of going into it. That was something that I don't think I've really shared with anyone in my life. Um, I did write about it on my college apps. I did do that, but it was something that I just had a difficult time accepting. Obviously, when given the chance for the transplant, I didn't say no. I didn't tell my parents that I didn't want to go through the transplant or anything like that because I knew that that was the next step. It was the next step. It was hard. It was difficult to kind of realize that change is sometimes good. Change sometimes can be for the better. But I went through the transplant, and I did have a couple complications post-transplant in terms of medications, but now I am where I am today, happier, healthier. I'm able to live my life a lot smoother than I did when I was on peritoneal dialysis. I can walk around without constantly being fatigued. I have less doctor's appointments than I used to. I have the ability to kind of work better overall, and my kind of dealing with everything got a lot easier post-transplant, even with some of the complications that happened post-transplant. I wouldn't say that post-transplant, every single thing went away. Obviously, the primary issue of chronic kidney disease was eradicated, but I do still have some issues on the daily. Sometimes I do still struggle with chronic migraines, medication taking, high blood pressure, dealing with all of that on the daily is still something I do have to endure, but it gets so much easier once you accept the illness in itself. Having a bit of support in your life is really important, whether it be from your family, whether it be from friends, whether it be from your doctors. But I think it's best sometimes to get that support from people that also understand the journey or also are going through the journey. It's something that is integral for ensuring that you are happy with where you're at, but also don't feel alone. I think being able to meet those kids that at my age that were also going through other things that I was going through, I felt supported in a way that I don't think I could have gotten from my parents. I couldn't have gotten from my sister, my doctors, my friends, anyone. It's obviously not easy to I don't want to blame anyone, obviously. I just want to say that, like, I'm so grateful for my parents, my sister, everyone that was in my life that was there for me. And I really appreciate everything they did for me. I wouldn't be where I am today without them. But it's a completely different kind of support sometimes when you have that from people that are going through what you're going through. So it's just which is why I've been working with Dr. Rastogi to kind of set up a support group for patients at UCLA, just so that everyone has the chance to converse verbally with people that are going through similar issues to what they're going through. Because everyone should have the chance to talk to others that are kind of enduring it, whether you're pre-transplant, on dialysis, hemodialysis, peritoneal dialysis, if you have CKD, ADPKD, whatever it is, meeting other people that have the same illness as you, so you feel somewhat connected to the community. This is essentially a community that you have here. Or if you're post-transplant, maybe you have some issues post-transplant, like I do, like maybe chronic migraines, being able to talk to others about your journey going through that, how you're living with it, how you're dealing with it, things like that. Just having that sense of community is just so important sometimes because it makes you feel not alone. And it makes that journey to acceptance so much easier. That's kind of a bit of a synopsis of my journey going through everything. And I'm hoping that this kind of helped everyone in some way of kind of providing a bit of clarity and a bit of support for you going through your journey, whether you're pre-transplant, post-transplant, whatever it is. A lot of my success as a patient was through the support of my family and the friends I made at the kidney camp, ensuring that I never backed down. I worked hard to get to where I am today. I worked hard on my journey, and I am really appreciative for all my doctors and everyone that supported me on the way. But I just wanted to share the journey, especially during Mental Health Month, to ensure that everyone knows that the disease does take a huge toll on you, but it's something that you do have to eventually accept, and everyone's journey to acceptance is different, but working towards that is very important. Not giving up is very important. Working hard on your health, whether it be in your diet, your fluid intake, exercise, making sure you prioritize all of those and whatever your doctor's treatment for you is really, really important in ensuring that you stay healthy before getting whatever treatment eventually or whatever the plan is for you in the future. So thank you, Dr. Stogie, for kind of letting me share my journey with everything and kind of all of that overall. So
Wow. Wow. And you're only 19, Disha?
yes, I'm only 19.
Okay. So you sound like you're 75. All the wisdom you have, thank you. I'm sure a lot of people in the audience have tears in their eyes, what you've been through, but you're a fighter and you got through this. There's a few things that I want, before I introduce Dr. Jim Cunningham. I think one of the questions that came up was about support group. Let me see, let me pull it up over here. This is from where is that? Karen. And I think what she said, and the question was to me, but you partly answered that. So, and her comment was, I'm almost 11 months post-transplant. I was on the list at UCLA, but received a deceased donor transplant elsewhere. My hospital has a monthly support Zoom for post-transplant patients, and I found it very useful. Knowing I'm not alone, like you were saying, Disha, in struggling with obscure diseases, which are not that obscure if you have a transplant, BK, CMV, my ongoing obsession with lab results, etc. I was speaking to my UCLA transplant coordinator, Bethany, and I think it's Bethany Durbin, who's a dear friend and has been on several of these chats herself, uh, and saying how much I hope UCLA can do this for post-transplant patients. And I really hope. So, anyways, the short answer, Karen, is that your prayers have been answered. Actually, one of the things Disha is going to do is start a patient support group, and we'll start off with a post-transplant patients, and we'll have other post-transplant patients join them as well. So I'll connect you with please do email us at the Core Kidney, and we'll take it from over there. I think the other thing, Disha, that I took from your is to never give up, right? There are
Right.
stages you feel hopeless. Why did this happen to me, right? And there are the stages of acceptance, and then you accept, and then the other point that you brought up, that then you are very comfortable with being on PD, right? You didn't want to go through another procedure, and this is one step, uh, further down. But I see the same thing for patients or getting in-center hemodialysis. They actually go to the center, and then you tell them get a PD catheter, and they says no, I'm comfortable. This is where I am, and
Right.
I've accepted it, right? And that mindset needs to change, right? Home dialysis, if you're on dialysis, transplant by far is the best option. And if you can get a preemptive transplant, that's even better. But that's a bit. But if you're on dialysis, what for the audience that's on today, um, ask the question, why aren't you in home? Because that is really the way. And then looking for transplant. Now, I before I get in, Jim, we have a lot of experts over here, and one of them is Jill, our amazing. And don't leave, Disha, because I'm going to continue with you. But this question is probably Jill can best answer this. What do caregivers need to know for both the kidney donor and recipient? That's the first part, Jill.
Oh, yes. Hi. Well, you can't do transplant alone. You do need caregivers. And that's one of the things that is part of our evaluation process to make sure patients have that social support before they get their transplant, because the caregivers need to be with them usually the first month. About we want 24/7 for that first month. Have somebody right there with you. Some people may need it longer depending on their abilities and their recovery. But usually that first month, you're going to need somebody kind of around the clock, coming with you to all of your clinic appointments, understanding your medications, the adjustments in the medications. So yeah, the caregiver is really essential in the success of transplant.
And they won't be listed, Jill, if they don't have
Well, sometimes people, we're going to need to wait a while, but you need to have at least a plan, and people that are willing, if you would get a kidney offer, soon after your listing, and then to update that plan over time. But
so
yes,
roughly
we
about
want
1 month.
them, yeah, we want them to have that plan in place before being placed on the waiting list.
But about 1 month, and depends upon the case too. The complications
Yeah.
they need.
Yeah, and some
But from the
people have disabilities that require, longer term
longer.
care and things like that. But for the most part, it's somebody who's going to be there 24/7 for at least that first month.
Right. And then so this was for the recipient.
Mhm.
The next question is about the donor. Do they need a caregiver?
Like a living donor, a
Yep.
living kidney donor,
Mhm.
yes. They will need somebody to be there and help them after surgery as well. It's probably not going to be for as long. Some people depending on what type of work they do, may be able to go back to work and get back to things more quickly, a couple weeks, to a month. So, but they do need that support at home because, they're going to be recovering from a surgery.
Yeah, great, great. Thank you so much. Now, let me introduce Dr. Jim Cunningham, our resident psychologist, and been very heavily involved with our patients, giving them advice, and also just giving them guidance how to deal with these day-to-day stresses. Yep.
Disha, again, thank you very much for your authenticness and your transparency, and some of the words that you say and the cornerstones of this conversation surrounding diagnosis and acceptance and the collaborativeness of the people who helped you, and the symbolic gestures your mother did to kind of scaffold you through all of everything that you went through, I think is profoundly beautiful, but also very effective in terms of, and I think it's kind of a template for the initial diagnosis and then the trauma of that. And then I think I don't like to use the words mental health. I think it's a buzzword these days for a catch-all for many psychological concepts. But for all intents and purposes, I think that's what you experienced when you talked about, the stages and the how you felt when you were first diagnosed and how you felt robbed of your childhood, and then you went on and there was acceptance, and you kind of maturated in the process, if you will. So and that's one of the things that I've experienced and I found with Core Kidney, that it's an educational piece. And you kind of slowly adapt to the situational diagnosis, and then you deconstruct the trauma of it, I guess, and you move forward and you get stronger. And but I do agree with you on the fact that there has to be hope. We talk about all these concepts. All of the cornerstones the collaborativeness, the self-care, the depressive piece, the situational depressiveness, and what I want to put forth in this conversation, and I hope it doesn't sound overly clinical, but I think the structure of a diagnosis and the structure of the eventual, whatever the diagnosis is, and the structure of getting a new kidney is really predicated on science. And when we start talking about all these esoteric facts about hope and about, they're all kind of integral to this one argument. And that is you learn about self-care, and not everybody's your age that was diagnosed. So I think that's also pivotal to understand. If you're in your 50s or if you're in your 40s, it's a whole different set of circumstances. But the basic template is still the same. The trajectory of the diagnosis, and then the acceptance, and the fact whether you do or you don't survive, and what you do with that. So that's why I found and most of the people that are affiliated with Core Kidney, the scenario so profoundly not just touching, but it works. It works. I don't want to fall back on the rhetoric of a 12-step program, but if you do your due diligence and you fight the good fight, I know I'm throwing every cliche in the world at it, and you work toward a common goal, and God willing, you have a caregiver and you have a donor, I think you're going to be all right. Most people survive. And I think once they get the initial diagnosis, they don't think that's the case. They think their lives are going to be cut short, or there's a lot of dichotomous thinking where they think they're going to perish And so, basically that's the whole lot of it. But that's every time I get on here, I talk about structure and I talk about hope and I talk about self-care. So I want to really come at it from a different way and basically insert that structure is really predicated on the science. And there's a way this works. And there's a way, you can control your diet. And there's a way you can control the bacteria in your gut. And there's a way that you can control your weight. And all of these, I think, lead to a favorable outcome or survival. So I don't know if that's just a hodgepodge of concepts. But the last thing I want to say is the profound correlation between one's gut and somebody's neurotransmitters in their brain. There's more and more evidence that suggests that most of the depression happens in your gut. So anyway, I don't know. Hopefully that's some of that resonates with you. And adaptation is another word that comes to mind. I think we're very adaptable and we're very, as you've proven, adaptable and resilient. And it's a long, laborious process, but if you accept the challenge, you will come out the other end and you can live a full, prosperous life.
Great. Thank you. Thank you, Dr. Cunningham. And don't leave. I'm sure there'll be.
Yes. And Dr. Rastogi, I don't like you calling me doctor. I want you to call me a psychotherapist. Thank you.
Okay. Psychotherapist, JC.
Yeah.
So don't leave, JC. I just want to comment from our transplant nephrologist, amazing transplant nephrologist, Eric Lum. So transplant success, especially the first month, requires a strong care team as you recover from surgery and high doses. That's the first 3 months when you get your immunosuppressive doses at higher doses. And the side effects are worse. So first 3 months, and also would mention they need a driver because we don't clear for 3 to 4 weeks. So I think those are important points to keep in mind when, and Dr. Lam and Dr. Sarkar, keep putting this in the chat box if there's anything else that you want to share. So Disha, the other question that came up is, what do you do for fun? Do you have any hobbies?
Yeah, so I'm an avid reader. I do like to read a lot of novels, a lot of different kind of genres I've explored, but I also am relatively active these days as well. I have taken to going to the gym a lot. I really enjoy spin classes, which is something new that I'm really into. Being at UCLA, being near the beach, I also like going on late night beach walks or late night walks around campus. That's also something that I really really enjoy as well. So those are some of the things that I've been very much into these days in terms of hobbies, aside from my education, aside from what my passion is in general. Yeah.
And what do you want to do in the future?
So as of right now, I'm very, very interested in becoming a nephrologist in the future. That is the eventual goal, to go to medical school and then become a nephrologist. Being able to use my journey to kind of support the patients, like having that ability to kind of connect with the patients on a different level, while also having the medical background to treat them properly and treat them effectively. I do want to eventually get into research as well to kind of dive into the treatments of chronic kidney disease, see if there's anything else out there, whatever it is. That's something that I would love to explore and just continue advocating for all patients and everything and raising awareness. Yeah.
And you're the right place. You're in the core. So
Yes.
so all this and a lot more. But it's amazing. It's very, very amazing. Very, very, and you can probably see the comments coming in.
Yeah. Thank you
the
so much
chat.
to everyone for all of your kind words.
No, I think they really mean everything. And so just want to follow up on what Dr. Lum said, and maybe you can share your story too afterwards. And I'll ask this question to Jill and Dr. Sarkar and Dr. Lum. So Dr. Lum said, it's a big surgery. You have to be strong, and you need a team. One of the questions that was asked is the BMI. And Jill, maybe I'll start off with you. and we're talking about the lower end of BMI now, not the upper end. So what do you recommend for your patients? What is the minimum BMI? And we're talking about adults, 18 years or older. What's the minimum BMI and what would be a preferred BMI?
Well, usually we want a BMI of about 18 or above. That's kind of the lower end. We have had some patients who their BMI is, a little bit lower than that, but that's kind of where they live, so it's a little, we do an individual assessment. If somebody's, recently lost a lot of weight and they're, below 18, we may want them to recover a bit and, try to gain some weight back before undergoing a transplant.
And we also have Shima, our amazing resident dietitian here as well. Let me just say, I think Dr. Sarkar put a note over here as well. And this is important. And the reason I'm focusing on this is, and this is what Disha went through, is you had to be prepared, and that call can come anytime, right? Unless you have a living donor, which is a bit more scheduled, but you have to be prepared. That is the hope. And when that call comes in, you have to be ready. And one of the things that we focus on core, and that's why we work very, very closely. So when we talk about the totality of care that we provide to our patients, it's not just pushing medications or procedures. It's about their mental well-being. It's about the nutrition, not even just BMI, a term that I'm not a big fan of to start with, the body mass index, but still that's a number that we go by. But what is the nutritional status, right? They could be overweight or normal BMI and still be malnourished or undernourished. Are they exercising? And I know I saw Dr. Let me see if she's here still. Yes, Dr. Mary Hannon is over here too, and she's going to be coming and speaking us at one of our chats on physical activity and exercise. So those things are very important, and get a good dietitian. And if you come to these programs, you'll hear a lot from Shima, but you have to have some leeway before you go into or reserve. That's the term. So Shima, I would, if you have some thoughts, you're also a transplant dietitian as well.
Hi everyone. Yes, absolutely. Because sometimes this is one of the big problems that, of course, there's like so many different like information out there that people sometimes try to get into so many different, like I call it diets. And then we don't actually want diet. We want a lifestyle change. And always, I say this to all of my patients always, this is only basically based on what you need. And sometimes I do have people that their BMIs could be a little bit on an even higher side, like you said, 30, 35, but all of a sudden they significantly lost some weight. And then we count that as a malnutrition. And then we don't want the muscle mass loss because then it becomes a problem later on. And then there's so much misinformation out there with so many different things like supplements that we hear it all the time. So that's why this whole like big group works together to make sure, because when you take different medication, you have to make sure that you're not getting into the drug nutrient interaction. You're not getting into the problem with taking like additional supplements because you heard somewhere somebody told you, or a family member told you, oh, like I took this supplement, take it. I hear it all the time about like mushroom supplements, a lot of like different teas from herbal medicines. So those can really interact. Even if you get transplant, it doesn't mean that you're free and then you can take whatever you want, what it says on internet. So these are like really different things that we usually go more in depth and talk about. And it plays a major role. And that BMI, exactly, I really don't like to just call the BMI because somebody might have really good muscle mass and then they can be like completely higher on the BMI, but they're like so lean. And it doesn't mean that they have to lose weight, or it can be the opposite. Sometimes people don't eat because they think that they're going to get a transplant. Then they get into trouble of, they go to a transplant center, they get evaluated and they say, hey, by the way, you lost a lot of weight. You don't have muscle mass. We cannot get you to the transplant. You have to wait and gain some wait and then come back to us. So these are like very crucial parts of the whole team that we need to work together.
Yeah. No, I think that's why I always, as you know, Shiva, most of my patients are seen by you, and sometimes they might think they're eating well, but it's also a balance in their diet as well. And there's always some, but you have to go to the right dietitian. That's really, really important. And that's something that everybody that comes on onto this program has to talk based on facts and science, not about their own opinions. And because this is a message that we give to our patients, and then they can do what they want with that information. But Shima, thank you so much. We will be doing your diet and nutrition programs are always very, very popular.
Thank
So
you.
we'll be doing
Yep.
in the near future.
It's a
Yeah.
pleasure. And Disha's story was, I was just like all in chills. Thank you so much for sharing this. Sometimes we all forget about like how precious our lives are. And then when you just like see a story like this, and then I was all in tears. Thank you so much for sharing. It's so inspiring. Thank you.
Thank you so much.
Thank you, Disha. So also, there are a lot of comments that Dr. Sarkar and Dr. Lum are putting in the chat as well. So please read them. I want to thank Christina and our Bruin Beans, our undergraduate club, and everybody else, and our panelists. So with that, I think we'll call it a day. We'll have, just to recap, Desha will be starting some support groups. And these will be led by her, but it's a support group. So patients will discuss what challenges they have, struggles they have, and hopefully find out what they can do. So stay tuned. I do also want to mention that we had a float in the Rose Parade this year. It was a huge success. I was on the fence whether we're going to do it or not for 2025, but by huge demand, we are going to have a float again in 2025, and this most likely is going to be an annual thing. So get ready and get the word out, and we'll be hearing a lot more. So with that, I just want to thank everybody.